We need your help to stop that spread in the community so that we aren't losing our nurses and our doctors and our respiratory therapists to quarantine or COVID, so that we can have capacity for the citizens of North Dakota. That's a really important thing. And if we do that, we'll be able to maintain capacity for the state, which is for everybody, for everyone that needs a hospitalization, because we don't want people waiting at home and not coming in if they're sick and they need medical care, COVID or not COVID. Second, most importantly, we're in an inflection point. So what do I mean by that? It's a technical term. As we look out, we're going to either go up or down here. And I want to thank the governor for the big move to be able to have a mask mandate and the other things that are, I know, difficult decisions. But we have to start to lower that curve, that growth, or what, if you want a technical term, the slope of how fast these infections are growing in the state. And why is that important? Because as we mask, and I'm just going to lay out my opinion, there's a lot of debate if masking is effective. I can tell you, I've read all the literature, I know it. It is effective. It's not perfect. It depends on what kind of mask you wear, how tight you wear, but it is effective, and it's one of the ways we know how to do it. Socially distancing, 6 feet or not. COVID is a respiratory infection. It's spread through droplets. Large or small, we can debate that element, but if you don't have something that impacts that disbursement, then you're going to infect more people. So that's an important thing. Hand washing, basic things like that. And then here's the big one that I'm asking everyone, which is a tough one. During these big gatherings, Thanksgiving, we need to be smart. We need to be thoughtful. We need to not have the huge gatherings where all of us can get infected. And I'll just give you a personal thing. I know this is hard. My dad's 93. My dad has a brain, I'd say, of a 20-year-old and a body of a 90-year-old. He is healthy, and the thing is, he's my best friend. And my family's a big family. We usually get together on Thanksgiving. It's going to be 4 of us. It's going to be my wife and my 2 daughters because we can actually track it. So I'm not saying that works for everybody, but I am asking you to be really smart, because it's not just about you. It's about not infecting somebody you love, or somebody someone else loves, or somebody that's vulnerable. This virus is exceedingly good at infecting individuals that have some vulnerability. Is it cardiovascular disease? Is it diabetes? Whatever it is, it's really good at that. So I'm asking you to do that so that we can serve the citizens and all the people of North Dakota well. If you want to use this analogy, we're fighting a really tough enemy. This virus, you got to give it the virus credit. It is, what it's made to do is to spread. It needs to infect and spread. That's how it keeps alive. And it's really good at it. It's a part of a virus that is the common cold. It spreads easily. And the issue for this is that when it starts spreading like this, it's the way it does this is in environments when it gets cold and we all get indoors. That is the perfect environment for this virus to succeed and beat us. So we really have to be thinking smarter, and we need to be able to stop this so that we don't have this really get worse as time goes on, and we can do it. Last thing is, there is some really light at the end of the tunnel. So we have 3 now public announcements of vaccinations. They work pretty similarly, which is in data that's concordance. It's telling us this is going to work. So we're going to be able to inoculate people faster, be able to get people in the front line and then the population. We can do this. So right now we need to be exceedingly smart so that we have as many people possible to get the vaccination and be able to do what we need to do, as the governor said, keep the economy healthy, keep people in school, keep to the things that we love to do, and I'm a big supporter of that. Last, I want to just tell you, I'm a doc first, and I've practiced emergency medicine all my life since 1991. And I worked last Thursday in a smaller area on yesterday in Fargo. I know people don't think there's some question if it's real, but I will tell you this. When someone can't breathe, and my colleagues can talk about it, just think about asthma. It is the scariest, probably the scariest thing that someone undergoes as a patient. And I can't tell you how many people I have already talked to saying, I don't know what this is. And you come back and you say, it's COVID-19, unfortunately. And right now, Google chest x-ray COVID, Google CT COVID. It devastates your lungs, and it does a pretty bad job on your kidneys and a couple other things. It is a bad disease. I wouldn't wish this on anybody. So I've seen too many people coming in and having to put breathing tubes on them. That is not what we want. We can do better. So I want to tell you that we're committed, and I want to tell you that all of the hospitals are meeting every day. It's at 11 o'clock. Chris Jones oversees it. The state's very involved. We all are transparent. We talk about how many beds we have. We can do this if we work all together, and I appreciate the leadership, and I appreciate the opportunity to talk. Thank you.
Thank you, Dr. Heegard, for your perspective from the front lines and from on behalf of the medical professionals in our state. Next up, we're pleased to have with us today Dr. Ranum. He's a proud native of Scranton, another Class B kid, which we love in North Dakota. He's a graduate of NDSU and, of course, UND School of Medicine, but he's been practicing at West River Health Services in Hettinger since 2012. He's currently the vice president, also the vice president of the North Dakota Medical Association. And for those around the state that may not be familiar, Hettinger is one of the top, not just one of the top rural health centers in our state, but it's considered one of the top rural health centers in the country, and they serve patients not only from southwestern North Dakota, but many from South Dakota, and some that come as far as Montana and Wyoming to serve them. But great that he's here today, and thank you, Dr. Ranum, for being here.
Thank you, Governor Burgum, Director Jones, VP3, and thank you to the legislators that we visited with beforehand. I was asked to come today to provide some insights into what's happening in one of our hot spots in the state, Adams County and Southwest North Dakota. The majority of my practice is in Hettinger, where I see patients in the clinic, hospital. I also cover the emergency department. Any point in time, I could be any one of those places. I also oversee a nursing home and clinic in Mott, North Dakota, as well as see patients in a nursing home in Lemon, South Dakota. So I have a very diverse practice setting. I care for young and old. Right now in our smaller community hospital, we have isolated one wing of the hospital as our designated COVID unit, and that has been running at capacity for most of the last 2 months, if not closer to 3. It seems like as soon as somebody's ready to come off the unit, whether that's off of quarantine or ready to be discharged home, or unfortunately has expired, it seems like there's 1 or 2 people ready to take that bed. What we've seen is a steady increase in cases in our area, which granted is one of the things that's going to happen with a virus like this. But we've seen the strain and things that it's put on our local health system. We've also seen the capacity issues that have developed across the state. In years past, I've been in practice for 8 years. In years past, we've had a typical wintertime surge when influenza gets bad, and sometimes you maybe have to make a couple of phone calls if a patient needs to be transferred. Already now in October and November, if we have a critically ill patient, COVID or non-COVID, that needs to be transferred to a larger facility, we're having to make multiple phone calls. Actually, just the other day, had to transfer a patient from Hettinger all the way to Ascension Fargo for some GI bleeding issues. I would be remiss to not thank our staff that is working tirelessly around the clock, our aides, our nurses, our ward clerks, our cleaning staff, our laundry. Everybody is working above capacity to continually care for these patients and make way for the next round of patients. We've actually been in discussions and from the beginning of the pandemic have been in a planning mode on how to expand our COVID unit capacity. And really what we're running into right now, as Dr. Hebert had said, is the staffing issues. Nurses and aides and others that are getting sick, which are limiting our capacity. And the ones you can get sick, they're the ones who get sick you can really understand and sympathize with. The ones that are just beating their head against the wall trying to get back in the game are the ones that are under quarantine due to a close exposure or household contact. We'd love to expand that COVID unit. I think we're going to have to regardless, but really what we're having trouble is keeping our staff engaged due to just the degree of illness in the community. I just read an article last night. Mayo Clinic has had 900 new positive staff members. When they did the contact tracing for those, 95% of those were considered community spread. So these people are not picking it up in the health system. These people are picking it up out in the community, and that's where all of us as citizens can play a part. The other part of this, to bring back the point of the talk about the inflection point, is we are at an inflection point. The models do have some scary predictions. Several weeks ago it was, hopefully we'll peak around Thanksgiving and then start to dwindle. Now it's this peak and just sort of this continuous onslaught of cases and illness and all the hospitalizations and death and everything that goes along with it. I was on a phone call last night with the Physicians Advisory Group across the state, and somebody relayed a story. There's a young patient in Cavalier County, northeast part of the state, who ended up getting sent to Iowa for an appendectomy. That highlights some of the challenges and the logistics that people are having to deal with. And imagine how many phone calls that took to get from Pembina or Langdon down to Iowa. I mean, that's a lot of time. This virus is real. There's no doubt about it. I'm incredibly glad that the case fatality rate is not 10% like was feared initially. It is much lower than that, and fortunately most people do well with that. However, you can't predict what anyone's disease course will look like, nor do we know the long-term consequences of the disease. These people are just starting to show up in our healthcare system with long-term consequences. I have a 99-year-old patient in the nursing home who did very well, and I've seen young, healthy people without any comorbid conditions be devastated or even killed from the disease. In our hospital, in the last 2 weeks, we've had 3 members from the same family that have passed away from COVID. My wife, who is a pediatrician, has had young athletes who have had a very innocuous, very mild illness not be able to return to sports because of lingering symptoms. We just don't know what happens with this disease long term. And you just can't predict, if I get it, it's going to do this. We don't know. The more you see, the more strange things that you see with this. I liken this virus to trying to pet a stray pit bull. You might do just fine with it, or it might rip your face off. Our inundated local health system and the state medical system would like to thank Governor Burgum and the Department of Health for implementing a mask requirement and the mitigation strategies of last week. These measures will help to rein in the out-of-control prairie fire that COVID has become in our state. We need to get back to flattening the curve. Our health systems are nearly overrun. There is a light at the end of the tunnel. What concerns me the most right now is not having the resources to adequately treat a non-COVID emergency like a heart attack or trauma that comes in the doors. You're 23 and healthy, your risk of COVID complications is very low, but you may get into a car accident. 55 without any underlying health conditions, hopefully the ER and the hospital are not overwhelmed if you have a heart attack. That's what all of us need to consider, and that's the message that I hope the public takes away from this. We are all 2 to 3 degrees of separation or less from a vulnerable population. You may never set foot in a nursing home, but you can infect someone who works in a nursing home who subsequently enters that nursing home and unknowingly spreads the virus. Please stay home for Thanksgiving. I know this is a huge ask for a major holiday, especially the way that 2020 has gone. Travel, though, can create many new pockets of infection. Those infected are shedding virus before the development of symptoms, meaning you can expose everyone at your holiday gathering and be back home before you show any signs of disease. Please sacrifice this holiday season so that you can enjoy future holiday seasons together as a family. Earlier this week, I was reminded of the Viktor Frankl idea that the Statue of Liberty on the East Coast should be balanced by a Statue of Liberty or Statue of Responsibility on the West Coast. For the same reason that I can't drive 90 miles an hour on the highway or shoot my gun in town, my responsibility to society involves wearing a mask and following mitigation strategies. Unfortunately, our new societal dividing line is 18 square inches of fabric. A mask has become the political litmus test of the moment. Perhaps the silos, tribalism, and thought control algorithms of social media have won. It's a mask. I'm a fairly libertarian guy. I do not see this as an egregious assault on my personal liberties. I see this as displaced anger at the disruption, destruction, and uncertainty of the moment. No one's coming for your guns, or as much as I hate them, your cigarettes. I'd be much more sympathetic to the mask as a personal freedom argument if a person's mask choice only affected them. However, my mask protects you, and your mask protects me. As the great philosopher George Costanza once said, we're living in a society here. Wearing a mask is an act of community support. It's protecting the vulnerable. It's loving your neighbor. Wearing a mask can keep kids in school and businesses open. No one wants to see business shut down. No one wants to see kids out of school. By the way, Governor Burgum, that's the one message my daughter wanted to pass on, is she wants to stay in school. It's about empathy. It's about putting yourselves in the frontline healthcare workers' shoes and seeing an onslaught of patients and not knowing if you're going to have the resources to deal with that. I think this is one of the things that we've all lost somewhere along the line, and certainly we've lost it in 2020, is putting ourselves in the shoes of others. Is what may have one appearance on Main Street has a different appearance in my emergency department or in my clinic or in the halls of Sanford or Essentia. We should all take a step back, cool down, and try to put ourselves in the shoes of others. And really, you may be at low risk of the virus, you may be at low risk of complications, but if a health system is overrun, you may put yourself at risk for an acute illness. In wars and in crises past, Americans and North Dakotans have banded together to do extraordinary things to meet the challenges of the era. This is one of those times. This is not a war, this is not the Dust Bowl, but it is a threat nonetheless. Everyone wants this to be over. I want your business to survive. I want our kids to remain in school. I want you to be able to visit your loved one in the nursing home. I want there to be a Class B basketball tournament next year. In order to accomplish these things, though, we must stop the bleeding and get our case rate under control. Thank you.
Dr. Ranum, thank you. wise and brilliant words spoken. Please tell your daughter that we want her to stay in school. We're fighting to keep the kids in school in person, so greet her for me. And I would say also that that there was a historic milestone there. It's the first speaker that's quoted George Costanza and Viktor Frankl in the same talk, and brilliantly and appropriately in both cases. So I'm predicting that talk's going to go virtual, maybe nationally. That was really terrific. Thank you. We know that taking action to preserve hospital space is an area where every North Dakotan can make a difference, and it's the primary reason that we announced the mitigation strategies last Friday, and purposely in time to make sure as we made those decisions, data-driven decisions, to get into the 10 o'clock news cycle last Friday night. We were trying to get the word out quickly about changes that were going to take place on Monday morning. Again, as been described by the two doctors here, we want to slow the spread of this cruel virus and save lives and livelihoods. And one way we do that is we slow the spread, preserve hospital capacity until such time that we have vaccinations, which will give us an enormous new tool. As they said in the White House call earlier this week, there's not just a light at the end of the tunnel, there's a very bright light at the end of the tunnel in the form of all these incredible advancements that are being made on vaccines. Since last Friday night, of course, we've received an enormous amount of feedback on those mitigation measures. As you heard today from our doctors and others, these mitigation measures have been widely supported by our medical community, including the North Dakota Long-Term Care Association, North Dakota Hospital Association, and the State Association of City and County Health Officials, because they know that these classic and practical and inexpensive mitigation strategies can help slow the spread now, help flatten the curve, help us get through this inflection point, help change the slope, and protect the vulnerable, keep our schools open for in-person learning, keep our businesses open, and prevent our hospitals from being overrun, as was said by the two doctors, by both COVID and unanticipated non-COVID needs, which happen every day, every week, every month, and especially in the wintertime. Earlier this week, in collaboration with the Senate Majority Leader Rich Wardner and House Majority Leader Chet Pollard, both who are here today, we did amend the suspension of winter sports and extracurriculars to allow practices to resume on November 30th with precautions in place to help minimize the risk of spread. We're honored to have both of them here today. We're also going to be hearing from a couple of school superintendents about what they're seeing in their district. Again, as we've implemented some of these measures affecting the public sphere this past week to slow this down, we can't overstate, again, what we've been talking about since last March, which is that in the end of the day, it's personal responsibility that's going to make a difference. And this personal responsibility can be by teammates, by coaches, by family members. The decisions we make about what mitigation we participate in, including physical distancing and masking, how we choose to get through Thanksgiving, all of those personal decisions are going to have a bigger impact on the outcome of lives than anything that government can do. So again, individual responsibility needs to lead in North Dakota. The CDC yesterday advised the same thing that our two doctors here spoke to, which is they're advising Americans to avoid traveling for Thanksgiving. They're worried, and rightly so, about a dangerous post-Thanksgiving spike of COVID-19 cases, particularly when this traditional, terrific holiday, my favorite, Thanksgiving always has been, generally is the time of year when we have multi-generational gatherings, large multi-generational gatherings. As was articulately said by the doctors, that these gatherings can be dangerous, if not deadly, for those that may be vulnerable. And we look at the United States, and you say, well, hey, let's travel someplace else. There have been more than 1 million new cases of COVID in the United States in the last 7 days. We hear in the Midwest, any direction you go, cases are high or even higher than they are in North Dakota. And again, this is a recommendation for the American public coming from the CDC, and they would ask for the health of your loved ones. Please to consider strongly celebrating Thanksgiving different this year, and perhaps, as Dr. Heegard said, with your immediate family household only. And now I know there's a misperception that young people sort of, quote, don't get COVID. but I wanted to throw out ahead of Thanksgiving a couple of data points. We've had more cases just among 20 to 29-year-olds in North Dakota since the pandemic began. 15,637 to be exact through today of cases between 20 and 29-year-olds than we do in the combined categories of those over 60, over 70, and 80 and over, which it totals 14,000 for those age groups. And we know that 20 to 29-year-olds can be pre-symptomatic and asymptomatic, so many of those that were tested in those age groups likely were tested because they had symptoms, and so there could be, if 2/3 of those in the younger age groups are asymptomatic, for every positive we find, there might be 2 asymptomatics in those age groups that have not been located yet. And so again, in this insidious disease, being young and healthy does not mean that you're not a spreader. So again, the safest way to celebrate the holiday is with the people you live with. And again, we ask all of you to do that, to find ways to expand this day of gratitude, to connect with others virtually as we go through this challenging time. And so again, to all have a happy Thanksgiving, but this year, make sure it's a safe Thanksgiving. We're going to quickly look at some numbers and then hear from the majority leaders. On the number side, we've got 9,900, just under 10,000 active confirmed cases in North Dakota. As I stated earlier, over 25,000 new cases already in the month of November. Our test positivity rate, again, 15% among all tests completed in North Dakota, much higher than what we want it to be. We talked about hospitalizations earlier, 289 due to COVID, another 106 that are in the hospital once they get there. If they come in for, say, an appendectomy, if you can find a spot to do that, then and get tested after you arrive and become positive, you're included in that second number. So there's 395 hospitalizations. We mention that because when a patient is COVID positive, that puts extra work on the hospital and hospital staff to make sure that infection control is in place for those patients that may have been admitted for a different purpose. Regionally, when we take a look at the upper Midwest, we continue to be in a COVID storm. Look at the case counts here, starting over in the Great Lakes in the past week, almost 85,000 new cases in Illinois, over 48,000 cases in Minnesota and Wisconsin, and South Dakota 9,000, and Montana 8,700. When we look at the positivity rate across the region, we see that there are some extremely high and some of the highest positivity rates in the country. There's 5 states in this region with positivity rates above 40%. It'd be Idaho, Kansas, Wyoming, Iowa, and South Dakota. And so again, these might be places where you might be considering traveling, but rates of infection very high in neighboring states. When we take a look at the rolling 14-day average, we're just over, we've hit 15.6%, and we take a look at this line, it's way too high, but we like the fact that in the last week that this appears flat. And so again, I would say just thank you to all North Dakotans who are practicing mitigation measures that have done your part to help slow the spread, because what we do in our communities affects what we can do in healthcare. When we take a look at hospitalizations, again, these are hospitalizations that are due to COVID. We're off slightly above our peak earlier in the week, but sadly, part of the reason that we're down is because if someone who was receiving hospital care passes away, that drives this number down. And it took us over 4 months, 135 days from March 11th, when we had our first case, to August 8th to reach 111 cases or 111 fatalities. We've had 111 fatalities in North Dakota in the last 7 days. We're we're all connected, as was said by the doctors. It's either 1 or 2 degrees of separation between the spread of infection and someone that may have the most tragic outcome from this unpredictable disease. But as always, our hearts go out to the family and friends who've lost loved ones due to COVID-19. When we take a look at counties, we're now in a position where every county in North Dakota has at least 2 active cases. The number of active cases tend to trend with our most populous counties, but also in those most populous counties is where we have our major hospital organizations. And so again, if you're in one of the rural areas, your care is going to lead you to one of those higher areas. And so again, we're all interconnected. If you within each other, and our hospital network is surely interconnected between rural and urban, and the need for transfers. When we take a look at those cases, Burley Morton combined with close to 1,900 active cases in this metro area, and the 3 other counties that have got over 1,000 cases, including Cass, and now Ward with a much smaller population at close to 1,200 in Grand Forks. And so again, we would have an opportunity to swamp our healthcare system just with the cases that are in the counties where our major hospitals are located. So again, this is why we're all in this together, because we have other counties with over 200 cases, Stutzman with 436, Stark with 358, Walsh with 327, very low population there, Williams 315, Rolette 255, and Barnes 220, and additional more counties that have got between 1 and 200. So when we take a look at active case rates across the state, this divides it by per capita. The darker counties here are the ones that have the highest rates per capita, and you can see again that, for example, that is in Ward County in the northwestern part of the state, where we do have hospital constraints. We're seeing more transfers from that part down to the central and eastern part of the state, but the cases per capita in some of those counties are up in Walsh are more than 2 times higher than we have in Cass County. So again, this is a statewide issue. Next topic is nurses, and we know that when nurses are needed for COVID and non-COVID, they're certainly needed when we have COVID hospitalizations. As we've talked about, it took us 5 months to get to 100 hospitalizations, took 4 weeks to exceed 200, and it took only 13 days for us to go above 3,000 hospitalizations due to COVID. This is the exponential growth in the infection rate of this disease. With these near record highs and immense pressure on our frontline workers, we were pleased that FEMA approved our request. We announced this last night for federal assistance, and they've authorized North Dakota to receive approximately 60 U.S. Air Force frontline medical personnel from the Department of Defense COVID-19 response operation, and these are primarily nurses, including critical care nurses. And those Air Force personnel will come from around the United States. They're expected to be here and on the ground next week. They'll join 167 nurses who are part of the North Dakota Department of Health COVID response team. Those teams will split into multiple special teams. They're going to support at least 6 hospitals in 4 cities, and these are our largest, but Trinity in Minot, CHI St. Alexis in Bismarck, Sanford Medical Center in Bismarck, Essentia in Fargo, Sanford Medical in Fargo, and Altru Health System in Grand Forks. And in addition to the 60 Air Force personnel, the North Dakota Department of Health, and in addition to the 167 nurses that are already there, we're contracting at the state level with a temporary staffing agency to provide an additional 60 nursing staff for hospitals and nursing homes, and those are funded with CARES Act dollars. As we continue to weather this COVID storm that's engulfing the upper Midwest of the nation with hospitals protecting a surge, we again are grateful to all the additional support coming from these incoming medical professions, but we're certainly grateful to the tens of thousands of people who've been working on the front lines, whether it's in EMS, in long-term care, or in our hospitals and clinics. We're grateful for the work you're doing to provide the very best care to North Dakotans. Next topic, as we lead in, relates to the school activities discussion and other things. As you know, we've amended last Friday's executive order. Team practices and rehearsals can resume with additional mitigation on November 30th, and competitions in that executive order will resume on December 14th. Our goal was and is to save the winter sports season. We understand how important this is to North Dakotans. The way we save the winter sports season is by decreasing transmissible moments now in November and over Thanksgiving. The timing and the 4-week cycle that was originally designed was between competitions was 2 incubation cycles, and that would help slow the spread and allow hospitals to catch up. We've heard feedback from lots of people, and many have said, well, you know, kids don't get it, kids are healthy, but I want to make sure that we stay data driven as North Dakotans, because kids are not immune from COVID, as you heard from the doctors. Among children ages 0 to 18, let's take a look at the positivity rates going back to August. 0 to 18 positivity in August, 5.3%. In September, 9.3%. October, 13.8%. In November, through the first days of November, the positivity rate in North Dakota for kids 0 to 18 is 21.1%. Currently, 3,500 or 35% of our 9,905 active cases are people that are under age 30. As I said earlier, most of these people that tested positive, if they're under 18, their parents brought them in because they were symptomatic, not because they're asymptomatic, and we know that this number could be doubled. We have unidentified spreaders. The silent, invisible epidemic that we're facing is also being contributed to significantly by young people under age 18 and those in their 20s. And so again, we're grateful, deeply grateful for leaders Wardner and Pollard for their collaboration. They've been side by side with our administration since last spring. The rhythm of the meetings that we had having multiple times a week went to daily as this has escalated. And I would just say that we're fortunate in our state to have legislative leaders who are true statesmen, who are thinking about all the aspects of our state, listening to constituents, listening to their caucuses, and collaborating to help drive solutions forward. Senator Wardner is going to come up first, followed by Representative Pollard. We're honored to have both of them here today, and I want to say again, thank you, Chet and Rich, for your leadership. Thanks for being here today.
Good morning. It's good to be here. I want to thank you for this opportunity for Leader Pollard and myself to make some comments. Academics will always be an extremely important part, and we want to make sure our kids are getting an excellent education, and it's a big part of what we do as legislators. But activities and recreation are also an important part to the mental and physical health of our students. We have to factor that when we make decisions about education. Extracurricular activities are an important part of the academic success and retention of our students in our schools. We want to develop the whole person as they're being educated and growing up in our communities, and I believe activities is a partner to the academics. As a former coach and educator, I understand the importance of keeping our schools open for in-person learning for students, and that's a goal for us, to get back to that point. Academic well-being and keeping students engaged in athletics and other extracurricular activities that promote their mental, emotional, and physical health. Numerous senators reached out with the concerns that they were hearing from parents, students, and when our student and citizens and coaches and teachers reach out, it's our job to listen. We believe this will address the pleas coming from the hospitals across the state to make swift, immediate action to slow the spread, while also balancing the concerns we're hearing from parents and students, allowing our students to get back into the practice arena sooner than later. I want you to know that local legislators had a huge impact on getting this changed. Our job as legislators is to listen to the people, and we do. I know some don't think we do, but believe me, we do. We read all those emails, and we talk amongst ourselves. And by the way, we can't answer them all. We can't return all the phone calls. It would be great if we had a staff, but we don't. When you see Leader Pollard and myself, you're looking at our staff. We are the staff. So our job then as legislators is to listen to the people. That includes doctors, nurses, school administrators, athletes, athletic directors, teachers, parents, students. We did that. And then we communicated with the governor and got an adjustment. And so, ladies and gentlemen, we're glad that we got that. As we move forward, I think this was a great compromise. And we want to thank the governor for working with us on this issue. Thank you.
Good afternoon, everybody. I'd like to start out a little bit of the history, what's happened with Senate Majority Leader Wardner and myself through the last few days, starting with Friday night. And that's what I'll start out with first. After Friday night, when the state health officer mandate and the executive order about the extracurricular happenings, needless to say, the emails and the phone started on fire. Okay, you know what I mean by that. So basically, Saturday morning, right away, I sent a text message to Lieutenant Governor Sanford and also to Mr. Beeler asking for a meeting right away that morning, of course, via phone, since Senator Warner's in Dickinson and I'm in Carrington. That meeting happened within 10 minutes. So the response was quick. And then after that, Saturday afternoon, we scheduled another meeting. And in that meeting, Governor Burgum asked to be part of that meeting, and we did that. And we talked about a lot of issues. Not only the extracurricular activities, but also the mask mandate and what's going on in the state. Since that Saturday afternoon, we also met Sunday via phone. We met Monday by a phone. We met Tuesday by phone at least a couple times, and also Thursday in between the, I'll say thousands of emails and the hundreds of phone calls. And I, as myself, as Senator Warner, we're trying to return as many as possible. It gets to be a little tough. So anyway, what I have found out, that we had good communication, and we brought forward a proposal, what we wanted to see after listening to a lot of folks and students calling as well and sending text messages to as well. So this is what came forward, is what you're seeing today. I myself am one. I have a daughter and I also have a wife who works in the school system, okay? I support efforts to safeguard our students, our faculty, and our staff from COVID-19. I understand that challenges are enormous in our school systems because I hear it every night, you know, and we actually get along. But I had to say the other night to my wife, because it was her birthday, and she said, I want nothing negative coming out of you for a while. I was able to do that for 2.5 hours, so just so you know. But anyway, so the times are challenging and the stresses are enormous, and I understand that. Like I said, we've had thousands of calls. Thousands of emails and hundreds of calls. I want to thank the citizens for reaching out to our House members and our Senate members, because there have been a lot of them. And some of them haven't been very pleasant, but in that discovery phase of what we think we need to do and to bring forward to the executive branch, we've done that. Our goal here right now should be helping to protect our most vulnerable citizens have our kids stay in school, because I think that's the most important thing, and that's why we did this, was because we understand the kids are going through a lot of mental stress right now, and we need to address that. This starts that process. There's a lot of folks that are questioning the response of all this and what's going on. And folks, that we can do in the legislative session in January. We'll have ample time to do that, and then we will take it from there, and there'll be plenty of discussions. But our goal today mainly should be helping relief to our hospitals, helping especially to our nursing homes as well, because they're going through, I won't say the word, but they are. And also so our students, so we can continue down this path of trying to get whatever normalcy is going to bring. I like the idea of the vaccinations, not the idea, but that's going to be coming forward. So there are many challenges ahead of us, but folks, let's take care of our most vulnerable citizens and try to work forward. Thank you.
Thank you, Leader Wardner and Leader Pollard, and thank you not only for your words today, but thank you for your incredible collaboration. I have to say, for my seat, that I think two of the toughest jobs in the state right now are being the majority leader roles, because they are working to listen to every single citizen in the state, and they're doing that with deep passion. And again, we've got citizen legislators, and the legislators and Chet and Rich represent the very best of that system. So thank you both. As we heard from Chet and Rich, they both got ties to the education system, so they understand through family members or personal experience what it's like to be involved directly in K-12 education in North Dakota, where we've got 120,000 students we're trying to keep in school for education, and we've got two superintendents that are here today, and Josh Johnson is going to speak first. He's been the superintendent at Valley City State, Go Highliners, since 2016, and Josh also sits on the North Dakota High School Activities Board, and so that also brings a great perspective. But want to give a shout out, thank Josh for being here, Superintendent Johnson, and Superintendent Thake from Williston, who's going to join us virtually. But really to say out to all of the superintendents in the state, this is another one of these positions to school board members and superintendents trying to lead a school through a pandemic. All of it's something that none of us have been through before. But again, thanks for all that leadership at the local level, and thank you, Superintendent Johnson, for being here today.
Good afternoon. Before I begin, I'd like to give a shout out to all of our Highliner staff and students back in Valley City that are joining this press conference from Valley City, getting an outstanding lesson, Governor Burgum, in science and civics here this afternoon. Thank you, Governor Burgum, for allowing me the opportunity to address K-12 education in North Dakota. For the past 8 months, our brave and courageous educators have been relentlessly committing themselves to supporting our communities, building relationships, and educating more than 110,000 K-12 students attending school in North Dakota. Last spring, our worlds turned upside down as the spread of COVID-19 made its way into North Dakota. As North Dakotans, we picked up ourselves by our bootstraps, dusted off, and began identifying solutions to our challenges. In education, that meant finding a way to bring our students and educators back into our schools. We know that this hasn't always been easy, and we have had our share of challenges. But together, bridging health and education, today in Valley City Public Schools, we will be successfully completing our 55th consecutive day of in-person learning. We wouldn't have been able to do that without a lot of partnerships along the way. Dr. Heegard, Valley City Public Schools has a strong partnership with Essentia Health. that was established long before COVID-19 ever came to be present here in North Dakota. We're extremely appreciative of that partnership through the work and efforts of Dr. Tanya Deagle at the local level, our local public health. So thank you so much, very appreciative. Valley City Public Schools has not been immune to the effects of COVID-19. Like everyone else, we have had our fair share of students that have been out of school due to being close contacts or testing positive for COVID-19. Last week, I met with more than a dozen students in our school to listen and learn from them and better understand what more we could do as educators to support their academic, physical, and social emotional needs. Senator Warner referenced listening and what we can do to respond and to support. Collectively, each and every single one of these students adamantly expressed their desire to continue with in-person education. I don't believe that they represent only the students at Valley City Public Schools, but the general population of students across North Dakota. Unsurprisingly, our conversation quickly turned to their concerns regarding mental health of their friends and classmates that have been out of school in isolation and quarantine. It was powerful for me to listen to our high school students express that being unable to come to school due to COVID-19 is leading to increase in anxiety, depression, stress, and suicidal feelings. Governor Burgum, I know that you and First Lady Burgum have been national leaders in behavioral health, and you both continue to provide your support for addressing these challenges in our schools across North Dakota. Mental health is one of the primary reasons why Valley City Public Schools has committed to keeping our school doors open. The mental health of our students is absolutely critical. We're unable to create those connections with our students when they're not in person, in our classrooms, interacting with our educators. In addition, other reasons why we believe that Valley City's public schools and schools all across North Dakota are committed to in-person learning is to support our parents, our healthcare workers, and our community. We stand together in support of these individuals and will continue to provide the best education and care for their children. As Governor Burgum referenced, I am a proud member of the North Dakota High School Activity Association. I love high school sports and extracurricular activities as much as anyone else in North Dakota. I believe activities, including athletics and fine arts, are a great benefit to our students' physical and mental health. This current pause to high school activities has allowed us to step back to evaluate the importance of educationally based activities. Students no longer take for granted the opportunities that have been provided to them to participate. Again, having that opportunity to meet with high school students last week, they expressed their strong desire to continue to participate in activities, even with increased mitigation strategies such as wearing a mask, limiting spectator attendance, and even, quite surprisingly, decreasing the amount of competitive events that they may be participating in. We know that this pause in competition is important to preserving the upcoming winter season and giving time for our state to see a decrease in hospitalizations, positivity rate, and sadly deaths. Now is the time for us to come together as communities to keep our students in school and recognize our ultimate purpose of education is the academic, social, emotional, and the physical well-being and growth for each individual student. Governor Burgum, Superintendent Baszler, thank you so much for your strong leadership and support for the continuation of in-person learning in North Dakota K-12 schools. I'm here today as a representative of amazing educators all across North Dakota. Before I end and conclude, I have the honor to present a picture that was drawn by Valley City Public Schools first grade student Max Rishmiller. Max has been out of school for more than 30 days this fall as a household contact, 30 out of the 55 days that we've had school in person this year. But the thing about it is Max absolutely loves the classroom, loves school, and wants to be there. She wants to be there with her amazing teacher, Mrs. Nancy Ost, and all of her classmates. Earlier this week, Max drew a picture, and in this picture, which I mind you was not an art project, it was an opportunity, some free time for her to be able to have some educational time. In this picture, Max wrote, "I love my class." I believe that this picture is just simply more than a first grade student putting something down on paper. I think it's a symbolic gesture of our students' strong desire to be learning in person in our schools across North Dakota. I also think it's an opportunity as North Dakotans to take a lesson from a first grader so that we can show a little bit more love to one another and be a little bit less critical and harsh relative to our opinions and our thoughts. So, Governor Burgum, on behalf of Max Rishmiller, Mrs. Nancy Ost, Mr. Troy Miller, Jefferson Elementary Principal, and all of Valley City Public Schools, we're proud to present you with a picture that was drawn that represents Valley City Public Schools and our strong desire to be in-person learning for the continuation of this school year. Thank you again so much, and I'm proud to be here and proud to represent. I'd like to also add, Governor Burgum, best wishes to the Northern Cass Jaguars competing in the volleyball tournament. We thank you so much for giving us that opportunity to be able to continue in competition. Thank you. Shout out again to our Highlanders in Valley City.
Thank you, Superintendent Johnson, and again, shout out, special thanks to Max. Thank you for this great picture, and I do agree that I think we can all learn something from first graders around the state about more empathy, more compassion, more love. So that's very touching. Thank you. Next up, Jeff Thake, Superintendent at Williston District 1, Go Coyotes, is going to join us remotely. And so take it away, Superintendent Thake.
Okay, Governor Burgum, thank you for the opportunity to share how Williston Public School District number 1 has been managing and mitigating during this pandemic crisis. I'd also like to give a huge shout out to Superintendent Johnson. What an incredible story you've shared with your district, and I'm very, very proudly serving Williston Public School District 1 and the outstanding students, staff, families that we have up here as well. In early September, our district mandated face coverings. We also created a weekly report card that shares our positivity rates with all of our constituents. We adjusted our face covering policy to one where masks became required. We noticed a sharp reduction in close contact quarantines and continue to reduce the spread in our schools. Between students and staff, we have nearly 5,000 people entering our 10 facilities. Our data shows that we are able to drastically reduce the spread by requiring masks in our schools. Of course, we have students and staff who have fallen victim to COVID, and I've heard some incredible stories as well from our students and staff. We also found out that most of our close contact quarantines and positive COVID results came from outside our schools. I'd also like to thank Mayor Howard Klug and the City of Williston for mandating masks. These steps will also slow the spread. One thing COVID has taught us is to be prepared to adapt and adjust accordingly. We know that none of the decisions we make to attempt to control the spread of COVID are always popular, but they truly are necessary. Our intent in Williston Public School District number 1 is to keep our schools open as long as we can by wearing masks, washing our hands, and establishing the necessary parameters to socially distance. Thus far, we have been successful. We continue to push the envelope towards innovation in public education with learning menus that allow for ample student voice and student choice. Our high school continues to structure career clusters with coursework by creating meaningful pathways for our students. We also opened the first of its kind ASB Innovation Academy for our middle-aged students, where collaboration, project-based learning, and real-world learning opportunities allow our students to create waves by exploring their interests and strengths. It is critically important for the social emotional well-being of our students that our schools stay open so we can stay on course. I'd like to thank Superintendent Baszler and Governor Burgum for your willingness to elicit feedback from educators, students, parents, and community members concerning winter sports. As this pandemic continues to present new challenges, our state has demonstrated a collaborative effort to make the best decisions we possibly can based on data. I also believe that a pause from activities is the healthiest, safest thing we can do at this time. It allows us to evaluate our current circumstances and make the safest, most sound decisions moving forward. We are proud of the steps we have taken in Williston Public School District 1, and we look forward to coming out of this pandemic, hopefully in the near future. I admire our ability to work together because, after all, in quoting George Costanza, a George divided against itself cannot stand. Thank you for allowing me to speak this afternoon.
Thank you, Superintendent Flake. And another record, two George Costanza quotes in the same day. But I want to thank both the Superintendent Johnson and Superintendent Flake for the outstanding job they're doing, leading their schools, working on mitigation, supporting extracurricular activity in sports, and keeping infections down in their system. Really, really strong leadership. We know that that's going on in many of our districts across the state, but thank you two for being here today. We're going to quickly go through a few topics and then we'll move to Q&A. But one of the things we want to clarify related to where people can reach out to provide feedback to the state of North Dakota. We have a North Dakota Public Health Hotline, and this is a place where citizens can call to get answers to their questions about COVID-19. And that number is 1-866-207-2880. So again, 1-866-207-2880. As you might imagine, listening to what the leaders shared and what our office and others, last week we had a lot of people calling that hotline to provide feedback. We'd like to provide the other channels for feedback and keep those hotline that's staffed with people that have ability to answer your questions about public health and people's health, about where to get tested, what about COVID, those kinds of things. So again, call the hotline if you've got questions. Many COVID-19 answers can also be found on the Department of Health website, which has received national recognition for its quality and comprehensiveness and its transparency. And again, that's at health.nd.gov. But your comments are super important to us, and remember that if the hotlines for questions, if you want to share feedback about the state's COVID-19 response, including any decisions that I've made. I think most of the state knows how to reach the governor's office because we've heard from everybody so far. But if you haven't, there's multiple ways, but one, if you want to give feedback to the state health officer, it can be made at health.nd.gov/feedback. And again, if you're calling to look for test results, you don't have to call the hotline. You can go online at health.nd.gov/COVID test results. If your test was taken at a private healthcare facility, hospital, clinic, contact them for results. And again, thank you to the hundreds of people that have been staffing the record number of calls at the North Dakota hotline and all the people that are working on keeping that website updated multiple times a day. Next topic is hospital ERG, the hospital economic, excuse me, not hospital, we've been talking about a lot today. This is the Hospitality Economic Resiliency Grant, hospitality as in bars, restaurants, hotels, et cetera. This was legislature supported this funding through the coronavirus relief funds, and the dollars have been approved. There's $54 million that were available. It opened this morning at 10 a.m. In the first 30 minutes, by 10:30, there was 400 applications that came in. If you're a qualifying business and intend on applying, I would encourage you to apply as soon as possible. The hospitality ERG, or Economic Resiliency Grants, will focus on reimbursing eligible hospitality businesses that were impacted during COVID. Bars, restaurants, breweries, cafes, and similar on-site dining establishment. It also focuses on businesses such as theaters, music, drama, entertainment venues, and professional production companies that support major venue events or meetings. And it can be used to reimburse businesses for costs like payroll, rent, operations, utilities, technology, and other expenses that comply with federal guidelines. And so I want to say thanks to the team at Commerce that stood up the new website for this. They've dedicated many hours in an effort to get these system ready for applications and to distribute funds. And applications can be found at the Commerce site at belegendary.link/HERG. On behavioral health update, which we include each of these since the beginning, as Superintendent Johnson described, this is an important component of our state and our individuals of all ages is making through the pandemic. But when COVID-19 certainly has just created routine disruptions, the disappointment that come from canceled events, and whether that's around holidays or school activities, whether it's missing being in person with your fellow coworkers at work, it's important to know that those around you, spouses, parents, or your child may actually be experiencing grief because of this loss and disruption. We've talked about before the Parents Lead website, and the Parents Lead website, which is available at parentslead.org, has got information for parents and recommendations on how to help your kids and how to help your family deal with disappointment, how to practice gratitude, and learn more about how behavior has an ability to impact others. And again, this is an opportunity for parents actually to lead by improving their skills and empowering other family members, including their children, to find appropriate ways to navigate all the stresses of COVID. So again, parentslead.org, and thank you to the great behavioral health team in the Department of Human Services in North Dakota that provides those inputs each week. When the gratitude, before we go to Q&A, know that Thanksgiving, as I said earlier, is my favorite holiday. It always has been. It's a time for us to reflect on the things for which we can be grateful. And if you're living in North Dakota and living in the United States, there are so many things for which to be grateful. This year is going to look different for everybody. We talked about that earlier, but we also know that North Dakotans are not only good at weathering storms, we're good at digging out afterwards. And right now, we can work together to help us make it through this storm, and we can give gratitude this Thanksgiving, not only to all the blessings that we have, but certainly give gratitude to all those healthcare workers that are working to save lives across our state. And as was described earlier by Dr. Ranum, again, this could be a great time for us to practice this Thanksgiving, some radical empathy and radical compassion and understanding about how we do all affect each other as we move through these challenges. One of my favorite gratitude quotes comes from Melanie Beatty, and it says, "Gratitude unlocks the fullness of life. Gratitude turns what we have into enough and more. It turns denial into acceptance, chaos into order, confusion into clarity. It makes sense of our past, brings peace for today, and creates a vision for tomorrow." And on my list of Thanksgiving blessings, I'm grateful for the leadership of Representative Pollard and Senator Warder. I'm grateful for all the superintendents, like those two that represented all of them here today. And I'm grateful for all of our hospital organizations and workers, and again, so well represented by Dr. Seagard and Ranum today. So grateful to have all of you here today. As I said at the beginning, we are having now, this today will mark our last press briefing, COVID press briefing here in the Capitol's Brynhild Hallgren room, and we're really grateful to the legislature who's allowed us to use the space during the pandemic, and especially want to give a shout out to the Department of Health team, including Clint Fleckenstein, who won one of the Team Member of the Year awards here from the state of North Dakota, and Paul Teeple. They've produced the live stream. They've served as the technical gurus that have helped keep information flowing to the public. And for the press that's been so dedicated to be here, here, we anticipate at this point in time that press briefings will move back to the Department of Health's facility on Burlington Drive in South Bismarck, which is where we started on March 12th. And in the meantime, stay healthy and stay connected. For the Q&A today, we're going to do it a little bit different because we've got great resources here and great speakers, but we're going to have our two doctors, if you want to come up here, and for the press and media, both in person and online. If you have any questions for the medical folks, we'll take those first. After they step down, then the two leaders will come up and take questions, and then finally the superintendents, and then we'll save everybody a little time for jumping up and down. But if there's questions for the doctors, address them to either one, and they'll come up here one at a time and take questions. Okay? Thank you again, doctors, for being here.
So from online, Matt Henson, WDAY. Doctors have repeatedly told us not to go home to see family for Thanksgiving. However, the governor and doctors have said it's okay to go to the bar or restaurant. Is there a difference between those two activities?
I don't know, I think you should. Step on that off, too.
I would say this. I think this is a different issue in the sense of trying to balance, the economic needs, which all of us need, and healthcare is a big part of it too, and what we also know can happen in super spreader kind of situations. And then what I mean by that is, I'll take my daughter. I have two daughters that are 18 and one's 24. There, as the governor has mentioned, and the stats show out, just not in North Dakota, but nationally, these are the highest risk. And the difference on that, in the sense that they can be asymptomatic, meaning they don't have the classic things like fever, cough, the thing we all know, loss of smell, loss of taste. They can have none of that. And my 93-year-old dad can be sitting next to it. It's not equal. So that's the issue. And then as you get bigger one, we've all read about families that are together and they lose tremendous amounts. That's the issue, that the risk is heightened at that point. So I do think there's a big difference, and I think it's important that we heed that fact that we got to be, as the governor said, North Dakota smart, North Dakota wise, North Dakota compassion. We got to be compassionate and thoughtful about this, and they're different entities. So, Dr. Randall.
Dr. Heber, I think it makes great points. Certainly your guard is a bit lower when you're with your family than when you're out at a bar or a restaurant. Many of our establishments are doing as much as they can to socially distance and limit the spread. I encourage people to take safety precautions in all settings, whether that's with visitors or whether that's out in the public with in a bar or restaurant setting.
Wondering if either of your facilities have adopted the asymptomatic workers coming back to work for the COVID wards, and if you could just kind of explain how they're being used, if so.
Not yet. I know that is something that we've looked at. I understand that that's a very controversial order. We have not had to dip into that resource yet from COVID positive healthcare workers taking care of COVID positive patients. Could that time potentially come? Yes. But Essentia, of course, much larger facility, may have a different policy.
So first, I would say we have not. We have not adopted that. And number two, and I have not discussed this with Governor Burgum, but that got a lot of attention. I think it's out of context. I think it's a sense, what that is that gave us a tool and a toolbox if things gets really bad. We are at a point, at least I can tell at Essentia, and I think most of the hospitals right now, and nursing homes can be a little different because they have a different staffing, but I'll just speak to the hospitals and I'll speak to Essentia. We have not had to do that, and we don't plan to do that. And part of that is that we would have to have COVID units, and we don't actually have COVID units. We have it intermingled, and we have negative pressure rooms to keep everybody safe. So, but you know, if it got really bad, we'd have to reconstruct, and they did that. You know, what the issue is, it happened all the time in New York and Washington in the beginning. We just didn't even know it. So, but we have not had to do that. So I think that's a good thing, and I'm hoping we'll have the staffing through our own, and the people being smart and wise and thoughtful for us, and then the travelers will be able to maintain not having to do that.
Today, the North Dakota Nurses Association held a news conference, and there were reports of nurses quitting their jobs because of working conditions at local healthcare facilities. Is 120 extra nurses that are coming in enough to support staff if nurses are not only being quarantined or isolated, but leaving?
I can address some of that. So, you know, I've heard some of that. I can, and I'm open to pushback. I was, you know, I think I mentioned I worked yesterday. I got done about 6. I went in rounds with our CNO, and I actually met probably 5 or 6 travelers. They loved it. I mean, they were really enthusiastic. They were supportive. They were a little nervous about the winter, but I will tell you, I haven't heard that. So. And I would be happy to engage in that. And so then you're talking about the turnover, 120. So it really gets to the point that I hope I talked about, which is it's the attrition rate. It's the rate that you're going to be having to quarantine. So I can tell you, you know, we have about 14 nurses right now, and I don't mean to keep going to nurses, but that is in many ways the most critical workforce issue that we have right now, respiratory therapists and other people. So if we can, and as was articulated, if we can reduce some of that spread occurring in the community, we rely on that less, and we will do it. And I also know that we're trying, you know, in addition to what the North Dakota is doing for us through the DOD and FEMA and the efforts at temporary staffing, we're all doing it too. So all of us, Essentia, Sanford, all through everybody, we're all trying to get nurses at the same time. So it's actually a couple different inputs that are going on. And I would just, I'd be remiss if I didn't say, you know, I want to thank all the staff at Essentia, all the hospitals. I mean, the people, they are, you know, they are working doubles, triples. I've been there, not being there for Thanksgiving. They'll be working nights on Thanksgiving. It's a huge effort, so again, I'm pushing. We'll be fine, I think, as long as everybody does their part as part of North Dakota. You, Dr. Randall, you want to add something?
You know, I've also started to, you know, I think 120, it's a start. Every bit helps. Everybody is doing a part. As we've seen, you know, COVID go from an acute right in front of us disease, which it still is, but now seeing some of those recovered folks in the clinic dealing with some of their consequences, I've been starting to think about some of the long-term consequences to our healthcare workforce as well. Even prior to the pandemic, burnout among clinicians, physicians on down to nurses and aides and other ancillary workers is you can't go to a meeting without hearing about that. I do worry about that as a consequence of this, almost a post-traumatic burnout, and I think we're going to see significant impacts to our healthcare workforce after that.
I'll go ahead. I think the concept of an overwhelmed hospital is sort of abstract to most people. What exactly does that look like? What would patients experience when they walk into a hospital that is overwhelmed?
You know, that can take different forms depending on where you are. If you're in one of the larger facilities, it might be a several-hour wait time to gain access to the emergency department. For a facility my size as a community critical access hospital, it might mean everybody's tied up with one thing. Our nurses float between, you know, back and forth from the emergency department to the floor. So it may mean you have several folks that are in critical illness at once, and people having to make choices and triaging, in many different scenarios at once. On a clinic end, it means, waiting times for appointments. People are choosing to forego screening tests. And we've, even in the 8 months since the pandemic has started, we've seen some of the delays and consequences. I have a very good friend who's a cardiologist here in town, and he said that they've had a dramatic decrease in acute heart attack activations, and he said, well, people haven't stopped having heart attacks. They're seeing the consequences of that. As I'd mentioned, to me, the greatest tragedy of an overwhelmed healthcare system is you don't have room for that extra patient. You don't have room for that car crash, that young child with asthma, emergency surgery, those sorts of things, and that's really where we'll start to see some tragic situations.
And I would just add this. What happens if a system, you want a graphic, think back at New York. I mean, so, I'm not a scaremonger, and that's not going to happen here, but think about what happens when something gets overwhelmed. You can't take care of these emergencies. You're trying to transfer people and not just, and they're waiting. You're not going to the OR immediately when someone has an appendectomy or they have something more, a trauma, aorta issue. So that, it's a degree, and we don't want to get there. So, we've talked about this, and I'm not sure if the exact models that have been shared, but, one model that we know, and that we spend a lot of time on modeling, is it perfect? No, but we know, and Sanford has done this too. We've done this jointly, and we share our information, we share it with the state. That if we don't dampen this, we might be up to 450 COVID cases by December 1st. Well, if we can't expand to that, and we're already stressed, then that gets us even more stressed. So that's why, and all of us are expanding very quickly. So we need to be, is it 500, is it lower? But we need that flexibility to move quickly so that we don't get stuck in this thing where we're transferring people down to Iowa, and that we can be at the ready for you. So.
Thank you, doctors. We've got our majority leaders here. I know they've got commitments this afternoon. We got time for a couple of questions for them if they are interested in taking them. And so Representative Pollard and Senator Wardner, if you guys want to come forward, I'm sure there'll be some hands popping up here. But we'll take a couple from the leaders, and then we'll move to the school superintendents and wrap up. Thank you again, leaders, for being here. Questions?
I have a question. November 30th is just a few days after Thanksgiving. Potentially a child who travels with their family to Thanksgiving could contract COVID and be asymptomatic when returning to practice and maybe infect the team. How heavily was that considered in this proposal to move practices back to November 30th?
Our biggest goal was to get those kids back practicing. And I'll tell you my philosophy, when kids aren't practicing, they're grouping up, they're doing things anyway. As far as I'm concerned, practice is an extension of the school day. And we feel that getting them back in practice is more important than anything for the mental health, for getting them back in a routine and a rhythm that they've been in before. So as far as I'm concerned, I'm not too concerned about that. I really am not. And they'll be testing them for temperature, and they'll be doing things of that nature. And just so you all know, for example, I know that I have a grandson playing hockey. They don't dress at the facility. They dress at home. They're doing all kinds of things to make sure that this doesn't spread. So I don't have a problem with that particular issue of Thanksgiving and then starting on the 30th. The whole idea in the negotiations was that is a 14-day incubation period, and then we started new. So And with all the other precautions, I'm not concerned.
Question. There was a lot of discussion today about communication after a decision is made. I'm wondering if you could comment on what communication is like before a decision is made.
So Jacob, are you talking about as far as our discussions with staff members, the lieutenant governor, and the governor? Is that what you mean?
Yes, sir.
If you want to know the truth, it's been open. It's been extremely open all the way through, at least I will say for myself. And I can't speak for Senator Wardner, but I know him and I have been a lot of conference calls together. So I have never felt we weren't being avoided or delayed. As soon as I talked to Mr. Beeler, I normally had a response within 15 minutes. And the same way, of course, the governor is a busy person, and so sometimes we would relay messages through Lieutenant Governor Sanford, but there's a lot of things we're working on besides COVID-19. So when that time comes, we talk to the appropriate people. So I would say the lines, at least for myself, have been very open.
Okay, if no other questions, we'd love to have the superintendents come up. Thank you, leaders, for your time and collaboration and your leadership. And I don't know, do we still have Superintendent Flake? Is he still online as well? The answer yes or no, but we'll start off with questions for Superintendent Johnson.
So I'm just kind of curious, in Valley City, are you seeing the shortage of substitute teachers that other districts are seeing? And are there ways to try to solve that problem?
Great question, and the answer is no. As of right now, we have not seen a shortage of available substitute teachers to be able to fill in, but what I can tell you is that we have been proactive in creating a three-step plan in order to be able to address that. We're going to begin with the lowest of priority needs, moving to a moderate level to a highest level, and each tier of that plan will have different increases within that, whether it's the increase of compensation or whether that is going to reach out and extend into individuals within our community who may not traditionally sub for us. At the highest level of consideration would be then for that, we have reached out to our business partners within Valley City and created partnerships that will allow us to be able to license substitutes that are currently working in other businesses in an effort to keep our schools open. And so our commitment, again, is to be able to overcome that obstacle. And I know it's real and it's occurring across the state of North Dakota. I think there's some ingenuity that needs to happen. We have support from ESPB, our licensing board, in order for us to be able to bring those individuals in and keep our doors open.
Is the Wilson superintendent online? Yes, Lisa, Clint, or all? Go on. You have Flake still on? I don't think so. Oh. Would you like to ask a question to follow up?
Okay, we'll go to questions online. Were there questions online for the superintendent, or?
The rest of them are for you.
Okay.
So James McPherson with BAP, could you comment on Sanford CEO Kravenhoff's statement that he doesn't need to wear a mask?
Well, the Kelby's sent a 2-page letter to all the staff. I had a chance to see it just before I came down to the conference today, and I think it's important for anyone to read that entire letter. And in that letter, he talks about the importance of wearing masks, which certainly is something we've been talking about all along. And any personal decisions that he's making, those are his personal decisions, but I think it's clear from the letter that Sanford believes in masks, and we're grateful for all the work that Sanford's doing here in North Dakota to help expand capacity. And we've heard today from both the doctors over here about the importance and efficacy of wearing masks to slow the spread. So I think, again, we've covered all that multiple times. Lane.
Governor, I'm sure a lot of people across the state are wondering this as well, but why now for these mitigation, or for the mitigation? Why not 2 to 3 months ago when we were seeing then record high numbers?
Well, I think that was really tied back to hospital capacity, which we said all along, that if we could manage, having our economy open, having our kids in school in person, manage as normal of life as we could, including activities and fall sports, completing all the fall sports championships. I mean, we're trying to fight to keep things open and balance that against hospital capacity. And when we saw these numbers really rising in the first 10 days of November, and then because of the close work we're working with the hospitals, that's when we saw the projections of rising cases means future hospitalization. So we're trying to avoid, a Thanksgiving or post-Thanksgiving crunch where we do get overwhelmed. And so that's what the timing of it is. And I know that we've got COVID fatigue going on in the nation and in our state, and so we're also sensitive to try to do the least amount we can and trying to balance. This is a risk management effort on behalf of all of us, and we again. Even before any of the quote mandates, we've been very clear for months and months and months that individual responsibility was going to be key to that, and it still is the same. It's going to come down to, students and players and coaches and parents and the community as a whole on whether or not we're going to have we're going to get through this thing, and whether that inflection curve's going up or whether it's going down. So it's still going to come back to what individuals do, but our timing was related to looking at the models of when we might run out of hospital capacity based on all the new infections that came in the first 10 days of November. I'm going to go to Jacob, and then we'll kind of go around the horn.
Governor, not too long ago, there was a health officer order regarding close contacts, and that order was changed almost the next day. On Friday, you made the announcement regarding high school activities, and within a few days, that announcement was changed as well. How do people in North Dakota know that when a new guideline is set, that won't change if there's even a little bit of pushback?
Well, I would say what they can count on from us as leaders is that we're making adjustments as we navigate a storm. I mean, this really is like a storm. And if I can use a sailing analogy, if you're in a storm, the winds aren't constant from one direction, and they can anybody that's ever sailed knows that you got to adjust the tiller. And as we're going through this every day, we got more information, we get more feedback. We get feedback from our great legislature. We get feedback from the leaders. We get feedback from parents and coaches. We also got a lot of feedback from nurses and frontline workers and medical association. And a lot of that feedback is in complete opposition to each other. I'm sure you've all seen it. I mean, we've got, group people that every day, every decision, it's either too much or it's too little, it's too soon or it's too late. And in the middle of that storm, we got to keep a hand on the tiller, and we keep driving forward. And so I'm completely comfortable with making decisions based on data and then taking new feedback and saying we got to adjust it a little bit and going forward. That's what it takes to actually get through this. I think ideology and rigidity in a storm would lead to sheer failure. You'd never make it through a storm if you never made any adjustments to your sails set, your direction, your tiller direction. You'd never would make it through. So this is part of what we have to do. Okay. Okay, I'll go back to online. Thank you, Mike.
Jacob Orland, the Tioga Tribune. What consequences will you impose on school districts declining to enforce the mask mandate?
I think that will be up to and discussed by the Department of Public Instruction. So we'll have to pass that on because I haven't been part of those discussions. But I think you heard today that a great way to keep kids in school and save the winter sports season is to actually do the mitigation. So I think I would hope that we wouldn't be in a position where we're on the other end of that. I would hope that we'd be following the leaders like the two leaders we had here today that are doing all the smart moves to keep teachers safe and keep their community safe and keep kids in school and keep activities going. Because if you want a winter sports season, the path to get there is a smart mitigation in the schools. Okay, we'll keep going online.
Mike Smith, 660 KYZ in Williston. Kind of going off of that, we're likely to see a Thanksgiving spike and a Christmas spike, and there's a good chance we won't see good numbers until after the new year. I I'm concerned about that and the timing of the return to high school athletics, as we could see a suspension due to those numbers. If the numbers are not better by December 13th, will high school sports and activities be in jeopardy of further delay?
Well, I think that there's a lot of speculation in that. I think what we're trying to do right now, if we all come together, is to drive these numbers down. And it's pretty simple. The doctors talked about it. This virus can only survive when it moves human to human. If we said for 14 days nobody in North Dakota got within 6 feet of each other, we'd end up with zero transmission. And so it's in our power to be able to slow the transmission. So if we decide we want to have, a more normal Christmas, we want to have winter sports, the actions we take now affect what comes later. And so I can't tell you what's coming in the future because I can't predict whether we're going to have more mitigation, same mitigation or less mitigation. But we know because of the rate of spread, the infection rate, we know when cases are going up, we know that our infection rate was climbing. An individual, someone with it was giving it to more than one person. If one person has it, gives it to only one person, our numbers stay flat. When our numbers go up, that means that one person's giving it to more than one person. And that's all, again, about, choices that individuals make. So it's up to everybody whether or not we're going to, everybody's got a part to play in this. And I, would love to quote basketball coach Bart Manson from the great Manson, his dad coached, his brother Ross played at NDSU, who I knew, and and he said last week, if we want the kids to have a winter season, and we do, then the whole community, he said, wear a mask for a nurse, wear a mask for a doctor, wear a mask for a teacher. That's what Coach Manson said. It's brilliant, it's true, and that's what we need if we want to save winter sports. I'm going to Morgan because I don't think you've had a question yet.
Yes, I haven't. So your statewide plan that you passed is different than the local ones before it because it has penalties attached. Some sheriff's departments, especially McKenzie County Sheriff Department, which has had a lot of press lately, have come out saying that they're not going to enforce the mandates. How can they go over your executive order like that, and are there any consequences for doing so?
Well, I think that the spirit of that order, we said it's about education first, and I think we've seen that virtually every law enforcement organization in the state says they're going to focus on education. This is intended to raise awareness about the importance of that, and so to all those law enforcement officers that are out there helping to educate, we say thank you to all of them. In terms of having the ability, which we did put that in place, even though there were local orders. We heard from county commissioners and mayors and city commissioners in our calls that said, man, if the state could do this, it would be a help to us locally. And so again, this was a decision made with a lot of local input. And as you know, there was a lot of mandates that went in before the state one. We want to support them. To the degree that sheriffs are independently elected officials, but to the degree that someone in law enforcement can say, I'm going to enforce the stuff I like and not enforce the stuff I don't like, I think that should give everybody pause. Because then you'd say, okay, is the legislature passes a new law and some sheriff in North Dakota doesn't like it, and they say, gee, I don't think I'm going to enforce that. And so I think in the posturing of the pandemic, we've lost a little bit of sort of the understanding that a civil society is built on the rule of law, and that would be I think a dangerous path to go down of picking and choosing which laws people would want to enforce. But in the meantime, we're grateful for law enforcement. They've had a really tough job. They're on the front lines. They're interacting with people. They had a big job before the pandemic, and now we're throwing something else on top of them. So I think the key role there is education. But if a mayor says, hey, we got a group that's holding massive parties without masks, we need some enforcement, that's the time that I think that, the public would probably say there's a reason for us to try to protect everyone, protect our, the vulnerable, protect the, students, teachers, nurses, all that stuff. So there may be a role for it, but, it'd be, if everybody acts individually responsible, there won't be a single ticket given in the whole state. We don't even have to go there. Okay. One more. Okay, Adam.
Thank you. You mentioned the hospitalization numbers. Last week there was a lot of national pushback on the decision to approve COVID-positive healthcare workers to go into work, as well as a lot of pushback from the medical community here in North Dakota. In addition to that, there were the comments from Governor Walz in Minnesota. Can you speak to whether any of those three pressures kind of impacted your decision to put the mask mandate in place on Friday?
I want to make sure where you went in the end, because I thought you were talking about nurses with a.
Sorry, yeah, that was probably confusing. So there was a lot of pushback on that order from last Monday, both nationally and in the healthcare community. And I think a lot of people in the healthcare community felt like mitigation measures should have come before the approval to allow asymptomatic COVID-positive healthcare workers to go into the workplace. I'm wondering if that pushback influenced your decision to put in place a mask mandate.
The quick answer is no, but I will give you more than that. It was input from the medical community that we allowed for, not required, but allowed for hospitals, if they chose, if they found a way where they could safely take an asymptomatic COVID-positive healthcare worker and have them work with COVID-positive patients. So we weren't adding risk of transmission. So that was an ask that we got, as you heard from Dr. Heegard. Today they said it was a tool in the toolbox, but the good news is that no one's had to go there yet. We wanted to have that tool in the toolbox ready because we said we have to be ready to look for measures that maybe appear to be more extreme, to make sure that if we saw the potential crush that was coming. And so it was not outside pressure. It was a data-driven decision about the modeling on increased infections that drive hospitalization. Hospitalizations reach capacity, and it's not about adding cots in the Fargo Dome. You can put as many in there as you want, or over here at St. Mary's. We don't have healthcare staff. And we know that there's 1,500 workers in long-term care approximately right now that are either out because of being positive or a close contact with someone. So we're taking a dent at a time when we need more, we have a dent in capacity in healthcare workers because of infection. So that's what was really driving the decision. The timing of the decision was hospital care, not any other outside forces. And so I hope that answers that question. But with that, again, I want to say thanks to everybody here. If we don't see you before Thanksgiving, thanks to all of our speakers today, the 2 leaders that were here. Thanks for your statewide leadership. Thanks, I see Superintendent Baszler is here and Chris Jones is here. Thank you for your continued work through all of this. And to the superintendents that were here, thank you for your leadership and great examples that you're doing. And the doctors, again, please extend a thank you all for participating in the daily stand-ups that we're doing and really working together. I think North Dakotans would be proud if they would understand how we've got competitors working together to look out for the best interests of everybody in North Dakota. So thank you for your continued work. And if we don't see you before Thanksgiving, everybody have a safe and happy Thanksgiving. Thank you.